Imagine waking up every day and not knowing if your legs will work and hoping that they do so that you can make it to the bathroom. Imagine every day being a 50-50 chance of being stuck in bed all day due to pain. Imagine your entire life revolving around a disease you cannot control. Unfortunately, this is a reality for over 2.3 million people in the world, including my mom. Today, I want to talk to you guys about multiple sclerosis, or MS. MS is a long-lasting autoimmune disease that affects the central nervous system. In this speech, I will discuss the history, causes, symptoms, and solutions to MS. First, let's take a look at what MS is and the history of it. Multiple sclerosis affects the central nervous system. So, what exactly is affected by this disease? It is considered to be an autoimmune disease, which means that the body attacks itself, and in this case, the myelin is being attacked. According to the National MS Society, these damaged areas develop scar tissue, which gives the disease its name, multiple sclerosis, multiple areas of scarring, or multiple sclerosis. This causes certain parts of the body to not receive messages, and in turn, not to function. The immune system of somebody with MS is different from a normal immune system. With MS, the immune system attacks the central nervous system, the myelin, the cells that produce the myelin, and the nerve fibers underneath. This damage can be detected on an MRI. Scientists are still trying to discover the cause of MS, and the history dates back to the 19th century. Because the symptoms vary widely and are unpredictable, this made the disease very hard to recognize, define, and treat. According to the MSAA, Jean-Martin Charcot was a neurologist who discovered MS in 1868. He believed it was hereditary and caused by weakness in the neurological system. Although there weren't many medical advancements during this time, he was not totally wrong. Charcot's belief that the disease is hereditary has continued to be a theory of the cause. Still, the exact cause for MS is unknown. But there are some telltale symptoms that can help doctors diagnose. The Mayo Clinic lays out some factors that are thought to increase the risk of developing MS. These include age, sex, race, and family history. White women ages 16 through 55, are at a higher risk of developing MS. And since both my mom and maternal grandmother have MS, I am at a higher risk of developing the disease later in life. Mayo Clinic also points out that people living in temperate climates are more likely to develop the disease. Temperate climates include Canada, northern US, Europe, and Australia. The cause of my mom's MS is attributed to the vaccine she received in the Air Force. Now, this is not a proven cause, but the military has recognized that the vaccines triggered the MS, which means that the disease was probably dormant before she received these vaccines. There are also many disproved theories over the years. It was once thought that living with a small pet or dog, having allergies, experiencing physical trauma, or exposure to heavy metals could trigger somebody to have the disease. And although the true cause is unknown, there are many telltale symptoms that doctors can use to diagnose people with the disease. Symptoms can vary widely and are unpredictable. Dr. Deborah Weatherspoon and the Healthline editorial team point out some of the first signs. Signs include vision problems, tingling and numbness, pain and spasms, balance problems, bladder issues, and cognitive problems. These symptoms can vary in intensity and may be stronger or not show at all in some people. There are also side effects such as emotional and mental challenges, including depression, irritability, and mood swings. My mom experiences most of these symptoms. She has spasms in her legs, can't feel her hands, can't remember things vividly, and has to sit down due to her legs shaking. She has trouble walking, balancing, and controlling her bladder sometimes, and she has constant pain. Her walking is her most noticeable symptom and the one that she has the problems with the most. These physical symptoms also cause her to have emotional problems. In an interview with my mom, she stated, "Every moment of my day revolves around disease. I have to position myself in a room where I can easily get to a bathroom. I have to make sure that I can either hold onto something or fit my cart wherever I need to walk." She also notes that the emotional turmoil is the worst part and the part that nobody can prepare you for. Because there are many different symptoms, this leads to many different treatments. While there is no cure, doctors and scientists have come up with several different treatments to help soothe symptoms. Doctors can prescribe medications ranging from pills to injections. My mom gets an infusion every 6 months, and it immediately helps her walking, so she can either walk faster or for longer periods of time. She has also been prescribed painkillers and antidepressants and all the medications in between. Marijuana is also used to reduce pain and soothe symptoms such as tremors. Medications are used to battle side effects, and most patients are prescribed antidepressants, pain meds, or bladder control medication. According to the National MS Society, there are over 50 medications that can be prescribed to patients. Other patients choose physical therapy to strengthen their muscles. They can choose from walking therapy, stretching, exercise, or other muscle strengthening routines. While there are many treatments and medications that doctors are using, there is still no exact cure for MS, so staying informed is the best way to lead scientists to find a cure. In conclusion, multiple sclerosis is a very confusing disease with no known cure, varying symptoms, and no known cause. Today we explored the history, causes, symptoms, and possible solutions to MS. I hope you all can imagine just how horrible the disease is. And I hope that in the future, scientists and doctors can find a cure for the 2.3 million people in the world, including my mom. In order for us to come close to a cure, it is important that we stay educated, informed, and share this information with others. Thank you.